Welcome to the first Rural in Reach program for the new year. My name's Fiona Reid, and today we're going to talk a little bit about the Rural in Reach program, how you can access it and how it can help people in rural and remote communities. And then we're going to have a discussion around general health and wellbeing. So with me today I have Sarah.
Hello.
And Janet.
Hi.
Who both work in the Rural in Reach program. And just to start us off, Sarah, can you tell us a little bit about Rural in Reach program and what it's all about?
Yeah, sure can. So the Rural InReach program is an innovative program which utilises video conferencing technology to provide health and wellbeing services to rural communities. It commenced in 2012, and the aim was to reduce the gap between the demand and supply of health services in rural regions.
Yeah, and as we've discussed before in other programs, we know that there's a vast gap between the health outcomes and wellbeing outcomes for rural and remote communities and people living in those communities in comparison to metropolitan communities. So higher rates of concerning health issues, high rates of anxiety, depression and stress and such things. So the program really was about trying to get some services out where in some cases there wasn't services, and in other cases those health and wellbeing services were overwhelmed by the amount of people needing to access them. Those outcomes for rural and remote communities, the more remote you are living, the worse the health outcomes often are for those communities. So using video conferencing, using some innovative approaches for people to be able to access health and wellbeing services from a wide range of programs was the intention. So what services can it offer to rural and remote communities?
Well, we have a counselling service, so as you can see there's Sarah, myself and Fiona here. We also have another team member, Nicole, and Nicole, myself and Fiona are all equipped to work with people who may not be able to access counselling or even just having someone to chat to.
Or maybe they want to talk to someone who's outside of their community about any health and wellbeing concerns, really.
Sure. Between us we have a fairly broad range of knowledge and experience, including family therapy, drug and alcohol work, domestic violence, Aboriginal knowledge and support, and
working with different communities, whether they be culturally and linguistically diverse. And it's not that we as a team necessarily have all of those skills and all of that knowledge. We have access to another wide range of services that are located at our main site in Northbridge. So there's about 80 staff that work across Women's Health and Family Services. So where we're not able to help someone, we can link them in with the most appropriate person to help them with that concern.
That's right. Also too, our program is not gender specific. Even though we originate from a women's health centre, we actually are very comfortable in talking to men and also young people as well.
So what are the services that people in rural and remote communities can access through the Rural in Reach program?
We have several services that we can offer people in rural and remote communities, one of which includes counselling. Now, counselling people can feel a little bit inhibited about that, but using it over video conference actually is almost the same as being in the same room as your counsellor. And between us in our team, we have a range of knowledge and experience. So not only are Fiona and I able to offer family therapy, we can also work with people around drug and alcohol issues, domestic violence, youth people, young people can certainly access our service, and we have had young people actually working with us and very successfully. Also, we have Nicole as well, who isn't with us today, who has also had extensive experience with Aboriginal people and the issues that they face. So we feel that we're very well equipped to help you, and if we aren't, then we can certainly refer either to your area, perhaps not your own community if you're under-resourced, but certainly to people who may do outreach to your town.
So we also have access to all of the services at Women's Health and Family Services. So all of those staff there, and we have around 80 staff on site at our Northbridge office. So that means that where perhaps we don't have the skills or expertise or knowledge to work on a particular issue, we can link people in rural and remote communities to someone who's best able to help them, or provide support to their local service provider, or discuss those issues and make sure that the best help is being provided at that time. But it's not just the counselling that's provided through the Rural InReach program, is it, Sarah?
It's not, no. We also have the community talks as well. Those talks are community driven, so they're based on suggestions that we get around things that people want to know about. So we do a wide range of health and wellbeing topics, and it can be from, menopause to mental health. And we really are open to suggestions, and if we can't find a speaker, within Women's Health and Family Services, we're happy to provide external speakers when required. We also do professional training and support, and that can be formal supervision arrangements, just around a bit of information and advice as well. We have a dietitian service. She's free of charge, and she's great. So we've had a lot of clients access the dietitian service at Women's Health and Family Services via video conference, and the feedback's been really positive.
And we also have a huge range of information and resources, and one of the first places to find those is particularly through the website. Definitely. All of the Westlink episodes are on our website. We have various information sheets and tip sheets around health and wellbeing. And we also are on Facebook as well, aren't we, Sarah?
We sure are, yep. And we pop our resources up on Facebook, particularly our video resources.
So if you look up Women's Health and Family Services on Facebook and like that, we regularly post to that site. Yeah. Great. And is the program available right across WA?
It is, and you'll see the slide that we're showing at the moment. That's got all of our 48 locations across WA. We cover all 9 regions of WA, and we also have 4 partnering women's health centres in Tom Price, Headlands, Southwest and Kalgoorlie.
So that's Bunbury and Southwest, yeah?
Yes, correct.
So this is really innovative and really quite a new way of accessing services. I'm just wondering what the response has been from communities. Janet, did you want to give us some insight?
Sure. We've overwhelmingly had very positive response from the community resource centres that we are partnered with, and we started with 30
sites we started with.
30 sites, and we now have 48 registered with us. And so we actively work with them to support their communities.
And that's the community resource centres that are found throughout WA.
You can also definitely call us on our 1800 number, which is 1800 998 399, and we're available Monday to Friday. And if we're not accessible when you call, then we all have messages on our phone, and you're welcome to leave it. We get back to you within 24 hours.
That's great. Thanks. And Janet, how can the program be accessed? So you've talked a little bit about you can go to the partnered CRCs, you can give us a call. Is there other ways that you can access the program?
Sure. Certainly if you have a health centre within your community that you can access through them, they can refer you to our service. Your GP certainly can refer to us. So anyone really, or you can self-refer, so you can, as I say, you can contact us yourself or through someone within your community.
And you can email,
Yep.
contact us, messages through Facebook.
Yeah, we have a website, we have a Facebook page. The Facebook page is, like Fiona said, under Women's Health and Family Services, but Rural InReach do post on it. And you can also go into one of the regional women's health centres that I mentioned earlier.
Great. So how do I find out where the community resource centres are?
You can go onto our website. We have all the locations on our website. Alternatively, there is a new interactive map on the website, and you can go on and have a look at what your closest centre is, and the number will come up when you scan over it.
I was going to say what you meant by interactive, so you scan over.
Yeah, you scan
Pick him
over
out.
the site and it comes up with the number of the CRC, so you can give them a ring directly, and it comes up with some pictures as well.
And if Rural InReach isn't in your local community, but you have a community resource centre, how might you access it then? Would you go to the centre and say that you're interested in the program?
Yeah, you could certainly go to the centre and ask about the program, and you could suggest that maybe they're looking to becoming a partner. We do have another 12 spots available for CRCs if they would like to partner up with us. Alternatively, if your internet connection is decent, we can provide services direct to someone's home.
And also perhaps through other health services.
Yeah, correct.
In the area. So if you'd like more information about the program or want to discuss with someone any health and wellbeing concerns you might have about yourself and a family member or a friend, just give us a call. Don't hesitate to contact us, or you can email us or send us a message. So we're going to move on from there and talk about health and wellbeing. What is health and wellbeing? What contributes to good health and ensures that our wellbeing is well looked after? So Janet and Sarah, these are terms that we talk about a lot, not just ourselves, but in media and in our communities. But how would you define health and wellbeing and why it's important?
Okay, so basically, what's that old cliche? If you don't have your health, you don't have anything. You can have all the money in the world, but if you're unwell, it's really not going to do a lot for you. So it's very important to put ourselves first and to do the best job that we can in looking after ourselves holistically, which includes looking after our physical health, our mental health, and our sense of well-being about ourselves. Also, our sexual health and spiritual health are in there as well. That's how I see it.
I agree with you, Janet. The World Health Organization defines health as holistic and not just an absence of disease. I think we've really moved away from that medical model of thinking that it's just about being free from disease. It's much more than that. It's everything that you see on the screen at the moment with the slide that we've put up, those 4 different elements, but it's also more than that as well.
It's the interaction of those elements and how they, the relationship they have to each other. So just sort of at a starting point, what are some of the routine health checks that we probably need to get done on a regular basis, and when do we need to do those?
Yeah, sure. Look, we can start at any age actually looking after ourselves, and really it's a great idea to start getting into good habits from a young age if you can. Certainly as you approach midlife or middle age, I guess, it is very important to make sure that all those health checks are looked at. For women around midlife, from 50 on, you can have mammograms every 2 years, which are free. Certainly men around about the same age, around about 50, it's recommended to get your prostate checked as well.
So with the mammogram checks, Janet, in rural and remote communities, how do they access those?
Yeah, there is a breast screen WA van which will go to local communities. So to find out when they're coming to your area is a really good idea to check online or give them a call. It's easy to find the number, and they advertise generally very well in advance of when they're going to be in your town or community.
And for men who can do a prostate check?
GP, need to go to your GP for that one. Not the most pleasant thing in the world, I've been told by men who've had them done. However, very important, because like any of these checks, forewarned is forearmed. It's very important to be proactive around looking after that aspect of your health. There are other health checks as well that both men and women need to be looking at around about between the age of 40, 50, I guess, just to get a baseline and start to address any issues that may have occurred. One of these is your cholesterol level. It stands to reason that, by the time you get to 40, 50, you've had all that time of putting lots of things into your body in the food line that can contribute to an increase in cholesterol, which then of course could lead to blockages, heart disease, strokes, heart attack, etc. So very, very, a very sensible idea is to get that checked. And that's just a simple blood test, which can be done when you go to your GP or health centre. Included in that is the blood sugar level. It also stands to reason that as we age, things are going to change because of the accumulation. Yes, a cumulative effect on how, as a result of everything that we've been doing previously leading up to that point. So get that all done at the same time. They can all be done at the same time.
And so the cholesterol and blood sugar levels, that's really about checking our heart health as
Yes.
well, and it's about
And also
checking for diabetes,
That's right.
which
Yeah.
are two of the biggest killers
Yeah.
in Australia. So
Sure.
really important checks, and to be able to maintain an understanding and know where we're at and what perhaps we can do to ensure that stays healthy.
Just with the blood sugar level, just before we move on, because of unfortunately the obesity crisis in children, they are finding that blood sugar levels are very high at the type 2 diabetes level. So if you do have any concerns about your child, they may be having symptoms of high blood sugar level, which include excessive thirst and going to the toilet a lot, or just two of them. It's also important to remember that you can get a child tested for blood sugar level as well.
Definitely.
Okay.
Yeah. And sometimes that can be as simple as just a finger prick, so it doesn't even have to involve a full-on blood test, as in subjecting your child to having blood taken, which often they wouldn't be too keen on.
No.
Yeah. Another important health check is our teeth, getting ourselves checked, ideally every 6 months. However, I appreciate that in some communities that's not practical. Definitely every year, factoring that in. I mean, we go and get our cars serviced at least every year, and it's a really good idea to remember to get your dental health checked as well.
And your dental health is not just about your teeth. There's strong relationships between the health of your teeth and your general health, particularly heart health and those sorts of things. So it's not just making sure that we've got good healthy teeth, it's about ensuring that all of our body is healthy and working as it should be.
That's
Yeah,
right.
and we do understand that cost is definitely a factor here. Dental health isn't widely available on Medicare. However, there are some publicly funded dental services available, and you can give us a call for a list of those. But alternatively, what I would suggest, or what I do, and not everyone gets a tax refund, but I always go to the dentist after I get my tax back. Yeah, and that's what I use it on.
The next thing that we're going to look at is our bone density. This is very important for both men and women, more so for women, because as we come into our menopausal years, our estrogen levels drop, which means our bone health is potentially compromised. We need estrogen for lots of reasons, but certainly to keep our bones strong and healthy. So round about midlife, it's a really good idea to get a baseline bone densitometry done, which is just a simple x-ray. So certainly something to talk to your GP about and look at doing that. It is interesting to note though that men can also present with osteoporosis. It's about 1% of men compared to women will actually have that, and generally the indication for them being screened is because they have a strong family history of osteoporosis in their families. We haven't mentioned pap smears. Pap smears are done every 2 years, or recommended for women to be done every 2 years. However, a lot of young women tend to think that this is not essential for them and put off having that done. What I'd like to reinforce here is that it is recommended, our guidelines here in Western Australia, that women or young women who have been sexually active for 2 years or longer, that is the time to start having your pap smear, or when you turn 18 years of age, if you are sexually active. So certainly something to consider and not put off. It takes about 5 minutes to have that done. It's a very small proportion of your day, and is over very quickly if it's done by an experienced practitioner. So that's something your GP can offer you, or your health practitioner in your town. What it does is it shows any changes to the cells in the cervix, which could potentially be life-threatening if
not found and addressed
that's
at a really
right.
early
That's
stage.
right. If they're not detected early.
So what about? Sorry, Janet, to interrupt, but I was wondering about blood pressure as well. Sorry, just before.
Yeah, sure. Blood pressure is something that seems to increase as we age. This is partly because of all the years of food that we've been eating that are causing our arteries to harden and to narrow, and so our blood pressure consequently becomes higher, which can then lead to strokes, clotting, and different health issues that are potentially life-threatening. So important just to get that checked every year, definitely.
That's a really quick and easy one to get checked. It's not invasive at all. It's just a cuff around your arm.
And some pharmacies actually offer that. So if you don't have a doctor in your town, or you don't have a health professional, then some pharmacies will actually also check your blood pressure. You can also get a home monitoring blood pressure machine as well, which are brilliant. They work really well.
Is there any other general sort of health checks that we should be?
Yeah, I would just probably want to mention sexual health as well. So often people maybe might assume that a pap smear and sexual health is the same thing, but not necessarily. You might have some sexual health concerns that are not to do with cervical changes. So yeah, really important. It can be something that people don't often get done because they're maybe a little bit embarrassed. But yeah, just making sure that you're on the right contraception for you and your partner, that you address any maybe sexual changes that you might be experiencing, and also getting some advice when you're thinking about starting a family as well.
I think what I want to actually say about sexual health is that it's very important for all of us to assume responsibility for that. So, for example, I can't really assume responsibility for my partner's sexual health. I would trust and have encourage definitely for him to actually address that part of his life himself, as I would do for myself. So that, of course, means talking about it together and accepting that responsibility around that aspect of your lives.
So in terms of our physical health, some factors that contribute to this we really can't change. There's hereditary factors. Sometimes it's just bad luck, or where we live creates issues for us. But those aside, what can we do? What do we have control over when it comes to our physical health?
Yeah, so generally those things are lifestyle factors. So things like our diet, our exercise, and whether we choose to drink alcohol, and whether we smoke as well. Also, under alcohol and smoking, they are a drug, as well as caffeine also. So just being aware of what we're putting in our bodies and what we're doing with our bodies as well.
So perhaps if we start with diet, which has come up a few times, particularly in relation to some of those regular health issues and checks. And it can also be really confusing. We get lots of information about what's a healthy diet and what's the right proportions and how to maintain a healthy physical weight in terms of our diet. What is the effect, and how can we make sure we have a healthy diet?
Yeah, so you're right, Fiona. There's so many mixed messages out there for diet at the moment, and there's a lot of people invested in diet, including the diet industry. So things like, Weight Watching campaigns and that kind of thing. And also then there's the government guidelines and the health organisations too. Keeping it simple is the best way to go. So a diet that's low in fat, low salt and low sugar. Eating some protein as part of a healthy diet, and the general rule is that it's the palm of your hand. So the bigger you are, the more protein that you can have. The smaller you are, the less protein that you can have. So yeah, just looking at this part of your hand here. You need to also have some calcium and some vitamin D. It's very important. So calcium you get from your dairy products generally speaking, but also some of your green leafy vegetables. And your vitamin D you can get from food, but my understanding is that mainly we get it from the sun. But they have an interaction, so it's important to make sure that you get both of those.
So sorry, when you say we get it from the sun, because we've been quite successful to some degree in Australia in the slip slop slap campaigns and making sure we don't get sunburnt and avoiding future skin cancers. So what's the recommendation in terms of ensuring you still get enough vitamin D naturally from the sun?
I think Janet might know that better than I do.
That's 10 minutes every day. So in our summer, you would be advised to get your 10 minutes, which is just exposure of your face, your arms and your feet, your legs, so your extremities basically, for 10 minutes before 10 o'clock and after 3 o'clock. In winter, it's any time of the day is fine, but that 10 minutes a day. And it's important to remember, which is what Sarah said, there is an interaction. We need the vitamin D to actually release the calcium from our foods so that it then nurtures our bones. So that contributes to our healthy bones.
So we still shouldn't be walking out in the sun exposed, in the middle of the hottest part of the day. We need to
you still need to pay attention to that very effective slip slop slap campaign, but it also is important to note that vitamin D deficiency is on the increase, and it's something that we're quite heavily testing now. So it's a give and take.
Sure. And to test for that is just a blood test. So maybe when you go for your annual check, it's a good idea to get your vitamin D levels checked as well. It's well documented now that a lot of women around menopausal age are deficient in vitamin D. It's also in women from other countries as well, and children. So it is very widespread. It is easily fixed. So if access to the environment isn't an option for you, then there is a simple tablet that you can get over the counter from your pharmacist, and that will help with those levels.
So also involved in diet is decreasing your caffeine intake. So very important that we don't have too much caffeine. Not only can it overstimulate us a little bit, but it can also lead to some of those more serious illnesses such as cancer. So the general rule of thumb now is 3 cups a day, and that can be tea or coffee.
At most?
At most, yeah. If you can do less than that, that's great. We also have to remember though as well that caffeine is in things like Coke, soft drinks and energy drinks, even dark chocolate. So, not just focusing on your tea and coffee, but being aware of it being in other products as well.
And green tea?
Green tea does have a lot of caffeine in it, yeah. So it's often seen as an alternative to black tea, but yeah, quite high levels of caffeine, actually more so than black tea. If you still love a cup of tea like I do, but you don't want to have the caffeine, switch to herbal. And check the back of the packet. It will say whether it's got caffeine in it or not. Before we move on, just want to make the point that a lot of people switch to the decaffeinated options of tea and coffee. At night, if you really like the taste of tea and coffee and you don't want it to keep you awake, it is a good option, but be aware that some of the things that they put in decaf tea and coffee are actually not very good for you. They're actually quite high in different chemicals.
So the process of actually taking out the caffeine can result in a build-up of other products within the tea and the coffee, unfortunately.
Definitely.
Yeah. It's also important to look at our portion sizes as well. So basically if you go by the rule of 3, so 1/3 of your protein on your plate, 1/3 of your carbohydrates, so that's your potatoes, your rice, your pasta, and 1/3 of your vegetables or salad greens, then that is what we consider, or what the World Health Organization now consider to be a healthy plate of food.
But be aware of the size of your plate. If you have a plate that's this big, then maybe not. Just be aware in the last 50 years that plate sizes have almost doubled in size, so they're actually producing now. A great way to reduce your portion size is to actually reduce the size of the plate or the bowl that you use.
There is something called the paddock to plate philosophy as well, which basically is looking at keeping our food as natural as possible. So not looking at the instant fix, and cooking everything from scratch, making sure that your foods don't have additives in them if you can avoid them, and keeping everything simple.
So really avoiding highly processed foods.
Yeah, definitely. Yeah.
Okay.
Is that what the slow food movement, Jana, is that similar? I've heard that term used as well.
It is, yeah. So it's cooking your bolognese sauce from scratch rather than getting one out of a jar, and actually reinforcing those practices that existed many years ago, where the health problems that existed in that time
weren't the same.
As they are now.
The food's not as processed.
Yeah, that's right.
So in relation to diet, there's the other consumption that many Australians and West Australians indulge in, and that's alcohol. Now that's really can be quite a big part of our culture. It's seen as being quite social and an enjoyable part of our lives. However, there are risks.
However, that's the key word there. There are some short and long-term consequences of alcohol intake. Some of the short-term consequences would be things like reducing your inhibitions, and that would increase your risk-taking behaviour. So you might be more likely to get in a car with someone who may be drinking, or more likely to walk in the middle of the road when maybe you shouldn't be doing. So that kind of behaviour which can cause injury, it's what you need to be aware of. It can also short-term memory loss and weight gain. Alcohol's full of calories and no nutritional content, so you can quite rapidly gain weight from drinking alcohol. Some of the more long-term, the more serious consequences of alcohol intake are toxicity, liver toxicity, and some cancers, malnutrition, and mental illness as well. So there can be some quite serious consequences to a heavy intake of alcohol.
I've actually heard that some young people are actually choosing to drink alcohol to get their calorie content rather than eat food, which obviously then sets them up for a type of malnutrition.
Yeah, because they do say, you know, it's empty calories, and what they mean when they say that is that it has no vitamins or minerals in it, so it completely lacks any kind of
and
nutrition.
plenty of sugar.
Yeah.
So those short-term effects of directly of drinking alcohol, but also the long-term effects of ongoing heavy alcohol consumption can really be quite serious and result in injury, death, relationship
Disease.
breakdown and such things. So is there a recommendation around what is safe alcohol consumption?
There is. So the Australian guidelines, first off, I'd just like to say that the Australian guidelines say that there is no safe amount of alcohol to drink. However, if you do make the choice to drink alcohol, for an adult it is no more than 2 standard drinks on any day, no more than 4 standard drinks on any single occasion, and that's for men and women. Also, what's recommended, and what's quite a new guideline, is a minimum of 3 alcohol-free days a week. The reason behind that thinking is that the liver actually repairs itself. It's a very clever organ, and so if we give it 3 days a week to allow itself to do that process, that actually protects our liver.
3 days in a row?
No, it doesn't have to be 3 days in a row. It can be 3 days whenever you choose to put in there. So Monday, Friday, Sunday, just try and get your 3 days in there, at least 3 days.
And by following those guidelines, if one chooses to drink, you reduce the risks of those immediate and long-term effects?
Definitely.
Great.
And just also, when you're drinking, always be aware of your environment and your personal safety as well. Very important.
I think what we also need to reinforce here is what is currently on our television screens and radio stations, and that is that young people, their brains are still developing at least until they're 25. So drinking before then could certainly have a potential impact on their mental health in the future.
And there's no safe drinking level prior to the age of 18, as according to the recommendations, and similarly around pregnancy and breastfeeding.
Yes, correct.
So another thing that we control in terms of what we put inside our bodies is smoking. And I just wondering if we can explore that a little bit in terms of its impact on our physical health and our well-being.
Yeah, we definitely can, Fiona. I'm not going to talk about it for too long because I feel that we've had some really successful media campaigns Australia-wide about the health effects of smoking. But just very briefly, it's a cancer-causing agent, can cause lung disease, it can cause tooth decay, it increases the incidence of asthma in babies and children, and it's highly addictive as well. If you are going to quit smoking, it's not all bad news. The effects are almost entirely reversible. So after 12 months, your risk of dying from heart disease is half of that of a smoker that's continuing to smoke. And after 15 years, your risk of a heart attack and a stroke is almost the same as a person who has never smoked. Also want to make the point now that generally people quit on their fourth or fifth attempt. So I know it's really hard, it's seen as being the hardest thing to give up, but keep on going because generally speaking, that fourth or fifth go and people will succeed.
You'll get there, and there's certainly a lot of help out there in the communities. There's a quit line, and you can speak with your GP or your local health professional and get support around quitting.
Sure can, yeah.
So clearly what we put into our bodies, our diet, any alcohol consumption, whether we smoke or not, has a profound impact on our physical health and our general well-being. What we haven't talked about yet, though, is exercise and the role that plays in maintaining and supporting a healthy body and a positive well-being. Can we?
Sure. Certainly exercise it has a lot of different sort of beneficial effects on our bodies and our sense of well-being, in that it does elevate our mood. It does help us to feel happier about ourselves. I know anytime I do anything proactive around exercise, I feel amazing. So it helps me to feel better about myself. It increases my sense of well-being and my self-esteem. I know that I'm doing it for a reason that's going to help me further on down the track, certainly. There are different types of exercise. Generally, the message today put out by health and wellbeing organisations is a minimum of 30 minutes of exercise a day. If you can do more, brilliant. But if you can get that 30 minutes in, and you can do it in 10-minute lots as well, so don't feel that you've got to put aside 30 minutes every day. You can actually break it up. Anything you choose to do has got to be helpful. If you are, however, wanting to build up your bone strength, then walking with weights on your legs and having them in your arms so you can swing your arms around with hand weights is actually going to help build that bone health. So that particular exercise needs to be weight bearing. There are different things that can help that as well, so like Tai Chi, which relies on the muscle bone ratio and contributes to healthy, strong bone health. Exercise certainly builds our muscles, so it stands to reason then it reduces our fat buildup as well. It slows down the aging process by when we exercise, we're exerting ourselves, we're breathing faster, we're taking more oxygen into our systems, and so our bodies are more oxygenated. It helps prevent type 2 diabetes as well. And also then of course lowers the incidence of heart attacks and strokes. So really essential to look at putting exercise into your life. It's like anything we do. It takes roughly 3 months for us to develop it into a habit. So if you're trying to put changes into your life,
more physical activity.
Yeah, that's right. Then it's good to just focus on that. Know that if you do it every day for 3 months, then it will become part of your general lifestyle.
Yeah, it'll get easier eventually, and do it with the support of someone, a friend, or if you're able to, a personal trainer, or a family member, and that can really help motivate you.
And sticking to it and seeing opportunities, I think, as well. It's not always any physical activity is better than none.
Absolutely.
So it's using the resources that you have around you, and making sure that you just get that minimum exercise in, and as you get fitter and healthier, you'll be able to do more and more. So just stick with it, really.
Sure.
So they're the things in terms of, they're quite concrete. physical things that we have control over, whether that be what we put into our body or how we use our body. What about the things that are a little bit harder to see, particularly in relation to our mental health, and that is thinking about that by 2030, poor mental health and mental illness is going to become the greatest health concern in Australia.
That's right. That's actually very sobering, isn't it, to consider that. And certainly, you know, we're all gearing up, getting ready for that, if you like, and looking at ways of managing that. But when we're feeling under par mentally, it can have a huge impact on us, not only ourselves, but our relationships. And that's all of our relationships, whether we're at work, at home, with our children, our families, our friends, our partners. It certainly can really also affect how we function day to day. You know, if you're feeling that you're not on top of things and you're not managing things very well, then that has a negative effect also on our self-esteem. We can also feel that we're suffering from physical illnesses when in actual fact it can be actually put right back to being overstressed, feeling depressed or anxious, and basically once that is addressed, then the physical symptoms can disappear.
So that physical and mental health are really directly linked.
Very much so, yeah. Not
Definitely.
only can I think that they can manifest in physical symptoms, but also stress, anxiety, depression can make original physical health concerns worse.
Absolutely.
Yeah, so
if I did have concerns around my own mental health, perhaps I'm feeling a bit low, or I'm concerned perhaps about a family member or friend that maybe they're not coping with stress, or they're just not themselves, where might be a starting point to get some help?
Yeah, I guess a lot of people I hope would go to their GP, because the GP is equipped to do an assessment and see exactly what's going on for you as far as your mental health is concerned. If it's about someone that you know or someone you're concerned about, then it would be appropriate for you to approach them and say, hey, I've noticed you look a bit down lately, or you've not been coping as well as normal. You know, is there anything I can do, or do you want to talk about it?
So genuinely asking,
genuinely caring about
are
other
you
people,
okay?
I think. Yeah.
I think that's the question, and being able to listen and hear that. What about networks though? What about our existing friends, family, work colleagues? Is that somewhere that we can...
Yeah, so you can access your own support networks. Yeah, like you said, friends, family, colleagues. Your workplace might have a employee assistance program that you can access. It's always worth asking. Yeah, and also there are other healthcare professionals that exist in a network that might not be a GP that will be able to assist. A counselling service, for example, is one of those things.
And if you want to be able to talk with someone within the Rural Inreach program, as was discussed before, you can give us a call, and that's a private and confidential service. So, you know, even if it's just to check things out and see, oh, maybe I'm doing okay, but I'm not feeling
sure.
my normal self. So just to be able to talk about that with someone else and see what you can do to put in place and maintain a good mental health, definitely. The other area is sexual health. Now, I know we talked about physical sexual health in terms of screening for infections and STIs and such. What might be the signs if we were concerned around sexual health?
Certainly it would be if there are any changes, if you notice anything. Most sexually transmitted infections, for example, you will exhibit some symptoms, whether that's an odour or an itch, any burning when you pass urine, any soreness, any lumps or bumps that may appear, then certainly that's something to go and have looked at. Unfortunately, some of the more common sexually transmitted infections, such as chlamydia, for example, don't have symptoms often. So if you feel that you are at risk, or it's something that you just like to be checked on, then that's an opportunity to go to your health practitioner and get that actually done. It's an easy test, and if it came back with a positive result, then it's easily treated. So certainly not something to put off.
And whilst getting checked for these around sexual health might be embarrassing, or might sort of want to avoid that, most of these are easily treated and have really good outcomes. However, also those symptoms might indicate a more significant health issue that really needs to be addressed and treated.
Definitely.
I think it's like any checkup you go to, you know, it's just to find out, it's just to double check these things. If there is something more significant going on, it's always good to know about it, because most things can be prevented, and that's what the whole idea of screening is about, really. And I think, you know, with that stigma, it can be hard. Definitely understand that sexual health has a certain amount of embarrassment about it, but important to know that, you know, your GP or your local sexual health clinic, they will hopefully always make you feel welcome, and there's no judgment placed on you.
And that sexual health isn't just the physical aspects, it's the emotional and relationship aspects.
Yeah, it's about communicating with your partner, it's about being in a relationship that's comfortable. So it's holistic. It's not just about those physical symptoms that we spoke about.
So we've covered physical health, what we put in our bodies, what we do with our bodies. We've looked a little bit briefly at mental health and the impact that has on our health and well-being, and also around sexual health, which is sort of the key areas in terms of having a healthy body and a positive sense of well-being. The last one that we pointed at in the beginning of this conversation was around spiritual health, and I think that's a very personal subject, but certainly has an interrelationship with our health and well-being, whether one is spiritual, religious, and I suppose for me that's about a connection to our communities, not necessarily a higher self, but for some people that might be. Do you want to just briefly, as a sum up, discuss what that might mean to each of you?
I think Janet and I really struggled when we were defining spiritual health. We had quite a long conversation about it. For me, it's about to kind of find a larger purpose and meaning for why we're here. But I think also it's not a journey that all of us go on necessarily. It's something that's quite often sparked around major life events. And I'll mention, if anyone's read the book Eat, Pray, Love, it's all about a spiritual journey that someone takes, and it's sparked around a major life event. I think it's really individual.
I think it is. For me, it's about getting in touch with that inner self, that place of stillness and quietness within me that I think we all possess. It's just how we actually tap into that and access that, which then guides us, in our day-to-day life and how we respond to different situations. Some of that can be achieved. People practice yoga, they practice mindfulness and meditation, and that's all designed to get us to focus inwards and be content, I guess, with ourselves.
But it also might be about how we contribute and interact with our communities as well. Whether we volunteer, whether we are part of a network of church might be, or it might be part of a social group. So I think it's, when we talk about spiritual health, we're looking at that health that sits in our relationships, whether that be a higher power within ourselves and with our external community. So I'd really like to thank Sarah and Janet for having this conversation today. There's so much more that we could have covered, and in some of our previous program episodes we've looked at these things in greater detail, so please you can go to the website and find out those episodes and watch them as you wish. But thank you for today, thank you for joining us, and we look forward to seeing you next time.
Thank you.